Media Advisory. Monday, October 2, 2023. Improving accuracy of screening would reduce disparities in early diagnosis and intervention. A tablet-based screening application for autism spectrum disorder (ASD) may improve early detection, suggests a study funded by the National Institutes of Health. Early detection is critical for access to early interventions that can have major long-term positive effects on symptoms and later skills. The app showed 87.8% sensitivity for detecting a SD, meaning it correctly identified most children with the condition. Its specificity, the percentage of children without an SD who screened negative, was 80.8%. By accurately identifying toddlers who warrant further investigation for a SD, the app may help healthcare providers ensure that children and families receive the support they need. Healthcare providers typically screen toddlers for a SD using a parent questionnaire. However, studies have found that the accuracy of such questionnaires tends to be lower in primary care settings compared to research settings, particularly among girls and children of color. This can widen disparities in early diagnosis and intervention. To address the need for more accurate SD screening tools, researchers developed the Sense to Know app, which records and analyzes children's responses to short movies designed to elicit a range of behavioral patterns. The app can track many early signs of a SD, including differences in social attention, facial expressions, head movements, response to name, blink rates, and motor skills. The work was led by Geraldine Dawson, Ph.D., and Guillermo Sapiro, Ph.D., of the Autism Center of Excellence at Duke University, Durham, North Carolina. Healthcare providers used Sense to Know to screen toddlers ages 17 months to 3 years during a well-child visit. Of the 475 toddlers enrolled in the study, 49 were subsequently diagnosed with a SD and 98 were diagnosed with developmental delays without a SD. The app's ability to reliably detect children diagnosed with an SD was consistent across toddlers of different sex, race, and ethnicity. Overall, participants who screened positive for a SD using the app had a 40.6% probability of subsequently being diagnosed with the condition. In comparison, only about 15% of children who screen positive using the standard parent questionnaire are later diagnosed with an SD. Combining the app with the standard questionnaire boosted the probability of a positive screen, resulting in later diagnosis to 63.4%. According to the authors, the study is a step forward in developing SD screening tools that can reduce disparities in access to early diagnosis and intervention. They also note the importance of ensuring that children with a positive screening result are linked to appropriate referrals and services. The study was funded by National Institute of Health's Eunice Kennedy Shriver National Institute of Child Health and Human Development, NIH-funded. Additional support was provided by National Institute of Health's National Institute of Mental Health and other organizations. Alice Cow, Ph.D., Program Director in NICHD's Intellectual and Developmental Disabilities Branch, is available for interviews. To arrange an interview with Dr. Cow, please call 301-496-5133 or email nishpress@mail.gov. Parachin S. et al. Early Detection of Autism Using Digital Behavioral Phenotyping. Nature Medicine D. OI 10.1038/S41,594-32023. About the Eunice Kennedy Shriver National Institute of Child Health and Human Development, NICHD, and ICHD leads research and training to understand human development, improve reproductive health, enhance the lives of children and adolescents, and optimize abilities for all. For more information, visit https://www.nisht.gov. About the National Institutes of Health. National Institute of Health. National Institute of Health, the nation's medical research agency, includes 27 institutes and centers and is a component of the U.S. Department of Health and Human Services. National Institute of Health is the primary federal agency conducting and supporting basic, clinical, and translational medical research, and is investigating the causes, treatments, and cures for both common and rare diseases. For more information about National Institute of Health and its programs, visit www.nate.gov. National Institute of Health, turning discovery into health registered.